Myself Abhishek Rai. I will be presenting my study titled the Short-Term Analysis of the Changes in Bone Mineral Density of Proximal Femur after Uncemented Total Hip Arthroplasty, a prospective study of 110 patients. This is the brief outline of my study. So the uncemented total hip replacement is the implant and or the prosthesis of choice in the modern era for the hip pathologies. As per the Wall's law, it states that the bone remodels according to the stress applied on them. So as per the principle of Wall's law, whenever we insert a proximal femoral prosthesis, the proximal femur gets bypassed and the weight of the body is transferred distally, leading to the periprosthetic bone loss due to stress shielding. Although groin zones were earlier described for the cemented total hip arthroplasty, for the ease of measurement, we included these groin zones in our study. As per the previous literature, the zones of concern are zone 1, zone 4, and zone 7. So we studied these three zones in detail in our study. DEXA scan is the preferred modality for the measurement of bone mass. Now, since the strength and the durability of the proximal femoral prosthesis in uncemented total hip replacement mainly depends upon the quantity and the quality of the surrounding bone, we plan to conduct a study to measure the preoperative and the postoperative bone mineral density in a case of uncemented total hip arthroplasty. So the aims were to study the changes in bone mineral density after uncemented total hip arthroplasty, to study the periprosthetic bone loss after the same, and to correlate the preoperative bone mineral density with the postoperative values. We included all ambulatory patients having unilateral avascular necrosis of hip undergoing uncemented total hip replacement. We excluded the patients who had a previous history of corticosteroid treatment, estrogen replacement therapy, metabolic disorders, non-ambulatory patients, and those patients who are having bilateral pathologies or who have undergone the opposite side total hip replacement. We excluded the patients who were previously operated on the ipsilateral side of the hip, and those patients whom mobilization were delayed because of an intraoperative complications. So it was a prospective study of a year duration with a sample size of 110 patients. We calculated the demographic data of all the patients, and the preoperative and the postoperative bone mineral density of the various zones with more emphasis on zone 1, zone 4, and zone 7 were measured by the DEXA scan. The study group, that is the affected site, was compared with a control proximal femur, that is the unaffected site. We kept it as controls. Now we can see in the results, this is the chart showing the mean preoperative bone mineral density on the affected and the control site. We can see that the bone mineral density on the affected site was significantly lower than the control site. Similar trend was seen at 6 months follow-up. What is important to see here is there was a reduction in bone mass in all the zones with a special emphasis on the three zones. But out of these three zones, the maximum reduction in the bone mass was seen in zone 7, that is the calcar area. So we concluded that a reduction in the periprosthetic bone mineral density of femur occurred in groin zones 1, 4, and 7 during the first 6 months after the THA. The greatest bone loss was seen in the femoral calcar area, that is the zone 7. The lower the preoperative BMD of the patient, the higher was the postoperative bone loss. So if a patient comes to us with a low BMD, what we can do? We have three options. Either we can give the preoperative pharmacotherapy or postoperative pharmacotherapy, or we can do something with the prosthesis design. There are already a few studies on that. The Huang et al. And Venesima et al., they have studied that the extensive porous coating and the long stem, they lead to more periprosthetic bone loss, thus leading to implant failure. There are few studies by Huang et al., Venesima et al., who have studied that the post-operative infusion of or the administration of the pharmacotherapy drugs like zoledronic acid, alendronate, and denosumab, it results in the restoration of the periprosthetic bone loss. Our study is having the largest sample size of 110 patients in the literature. We are still continuing the study, and our study proposes the fact that do we need to make it a regular plan to give the pharmacotherapy drugs post-operatively to all the patients who are undergoing uncemented total hip arthroplasty in the form of zoledronic acid or denosumab or alendronate. It needs a multicentric study with a larger sample size. Thank you.